cells, the leukocytes. Leukocytes or white blood cells are the only formed elements that are actually complete cells, which have nuclei and organelles and are, in some cases, capable of mitosis. They only make up less than 1% of the total blood volume, 4,800 to 4,800 to 10,000 white blood cells should be found in a microliter of blood. They are all going to be involved in defense against diseases. They can leave the capillaries through a process called diapedesis, and then using amoeboid motion move through tissue spaces, and they do so by following the trail of chemicals in a process we call positive chemotaxis. So leukocytosis is a white blood cell count over 1,100 per microliter. That could be the normal response to an infection, but leukocytes are grouped into two categories, granulocytes and agranulocytes, based on whether they have cytoplasmic granules or not. A good mnemonic to remember: the decreasing abundance in blood is never let monkeys eat bananas. So neutrophils, most abundant. Lymphocytes next. Monocytes, eosinophils, and then basophils are quite rare. So this is a representation of that buffy coat, and within that buffy coat you would have the granulocytes, the eosinophils, the basophils, and the agranulocytes. So here are some granulocytes: a neutrophil, an eosinophil, a basophil. The agranulocytes are the lymphocytes. We don't know if this is a T or a B. And the monocyte. So neutrophils, eosinophils, and basophils are larger, shorter lived than red blood cells, so less than 120 days. They contain lobed rather than circular nuclei. The cytoplasmic granules stain specifically with right stains, and these are all phagocytic cells, at least to some degree. The most numerous would be the neutrophils, about 50 to 70% of white blood cells. They are approximately twice the size of a red blood cell. Their granules are going to be staining with rights in both the acidic and basic dyes. They contain hydrolytic enzymes or antimicrobial proteins such as defensins. And they are also often referred to as PMNs or polys or polymorphonuclear leukocytes. The nucleus has several lobes. It can be between 3 and 6 lobes. Neutrophils are very phagocytic. They are bacteria slayers. They kill microbes by a process called the respiratory burst. Cells are going to synthesize oxidizing substances such as bleach or hydrogen peroxide. Defensin granules will then merge with the phagosome and form spears that pierce holes into the membrane of the ingested microbe. Here are the granulocytes. These are neutrophils. Eosinophils, 2 to 4% of leukocytes. The nucleus has 2 lobes connected by a broad band like earmuffs or dumbbells. They are more red staining, having digestive enzymes that work more with the acidic dyes. They release enzymes on large parasitic worms to digest the worm from its surface inward. And they also play a role against allergies and asthma and are part of the immune response modulators. Basophils are the rarest. Only 0.5 to 1% of leukocytes are basophils. They have a deep purple nucleus because they stain the basic region, basic dye from the right stain. Large purplish black basophilic granules. They contain histamine. Histamine is an inflammatory chemical that acts as a vasodilator and attracts white blood cells to an inflamed area. And guess that's what I'll say about them. Here is a basophil. The agranulocytes don't have visible cytoplasmic granules. They are either lymphocytes or monocytes, and both have a spherical or kidney-shaped nucleus. Lymphocytes are the second most numerous white blood cells. They account for about 25% of the formed elements. They have a large dark purple circular nucleus with a rim of blue cytoplasm found in lymphoid tissues, but few do circulate in the blood. There are two types of lymphocytes, T lymphocytes and B lymphocytes. The T lymphocytes are going to work against infected cells or defective cells in some cases, whereas the B lymphocytes are going to release a protein called an antibody that will be specific for the pathogen, and that B lymphocyte will then proliferate. Monocytes are the largest of all the leukocytes. They make up about 3 to 8% of all white blood cells. They are abundant in pale blue cytoplasm. They do have dark purple, U staining, or kidney-shaped nucleus, and they actively phagocytize. They are crucial against viral infections, intracellular bacteria pathogens, and chronic infections. They activate lymphocytes, and they help to mount an immune response. We're going to see that they are helpers for T cells and B cells when we get to the immunity chapter. So if we're making or studying the production of leukocytes, the process we would call leukopoiesis is stimulated by two types of chemical messengers from the bone marrow and other mature white blood cells, basically grouped into interleukins and colony-stimulating factors. Interleukins will be numbered. Colony-stimulating factors are named for the white blood cell that they is produced in response to their presence. So, for example, a granulocyte would be a granulocyte CSF would stimulate granulocytes to grow. All leukocytes originate from a hemocytoblastic stem cell that very early on makes a hematopoietic stem cell that very early on makes a commitment down either the lymphoid stem cells or the myeloid stem cells. Myeloid is all the other elements. Lymphoid is the lymphocytes. And that begins with a process of making a myeloblast that arrives from the myeloid stem cell to a promyelocyte, to the myelocyte, to the band cells, and then maturation of the granulocyte. The nuclei becomes fragmented before being released into the blood. 10 times more is stored in the bone marrow than in the blood. About 3 times more white blood cells are formed than red blood cells because white blood cells have a shorter lifespan, and that's because they're busy fighting microbes for us. Agranulocytes would include monocytes derived from the myeloid line. So the pathway would go from monoblast to promonocyte to monocyte. They do share common precursors with neutrophils, and they can live for several months in the body. The lymphocytes are derived from the lymphoid line, and they would include the T lymphocytes that give rise to immature T cells that mature in the thymus, and B lymphocyte precursors that give rise to immature B lymphocytes that mature in the bone marrow. In both those cases, when we say mature, we really mean learning the difference between your own tissues and invading tissues. Lymphocytes can last quite a while, hours to decades. So here is a schematic which I would recommend that you go through. to take you to your eosinophil, basophil, neutrophil, monocyte, and B and T lymphocytes. Again, lymphoid, myeloid, committed, and then a developmental pathway. Many hematopoietic hormones, EPOs, and colony-stimulating factors are used clinically. They can stimulate bone marrow of cancer patients receiving chemotherapy or stem cell transplants. They also have been used to increase the protective responses of patients suffering from AIDS. Overproduction of abnormal white blood cells is a leukemia or an infectious mononucleosis. An abnormally low white blood cell count would be classified as a leukopenia, which can be drug-induced, particularly anti-cancer drugs or glucocorticoids. Leukemias are cancerous. They involve the overproduction of abnormal white blood cells. Usually these arise from clones of a single abnormal cell, and they are named according to the abnormal white blood cell clone that is involved. So a myeloid leukemia would involve a myeloblast descendant, and a lymphocytic leukemia would involve a descendant of the lymphocyte pathway. They can either be acute or chronic. In acute, we have quickly advancing. Leukemia derives from stem cells. These primarily affect children, and we do have very good treatments for many of these now. Not all of them, but many of them. Whereas the chronic ones are slowly advancing, and the leukemia involves a later stage of differentiation. And that tends to be more prevalent in older people and sometimes less amiable to treatment. But without treatment, all leukemias are fatal. Those immature, non-functional white blood cells flood the bloodstream. Cancer cells fill the red bone marrow, crowding out the other cell lines, so anemia and bleeding will follow. Death is usually from an internal hemorrhage or overwhelming infection. Some of the treatments for cancer you may be familiar with, but it would include irradiation, anti-leukemic drugs, and stem cell transplants. Infectious mononucleosis is a contagious viral disease, sometimes called kissing disease, usually seen in young adults. It's actually caused by infection with the Epstein-Barr virus, and that infection leads to high numbers of agranulocytes, not typical agranulocytes. Can be in the lymphocytes that become enlarged. Originally, they thought those were monocytes, so they were called the disease mononucleosis, but it turns out they're agranulocytes, lymphocytes. Symptoms would include tired, achy, chronic sore throat, low fever, and it runs its own course with rest in about 4 to 6 weeks. Platelets are fragments of a larger cell called a megakaryocyte. They are blue staining outer region and purple granules within them. They contain several chemicals involved in the clotting process: serotonin, calcium, some enzymes, ADP, platelet-derived growth factor. They are a temporary plug that forms in blood vessels when a blood vessel is broken, and we'll talk more about that process later. They are circulating platelets are kept inactive and mobile by the presence of nitric oxide, as well as prostacyclin that's produced by endothelial cells lining blood vessels. Platelet formation is regulated by a hormone called thrombopoietin. It's formed in the myeloid line from the megakaryocyte, stage 1 megakaryocyte. Mitosis is going to occur, but no cytokinesis, so we end up with a very large stage 4 cell with multi-lobe nucleus. That stage 4 megakaryocyte sends cytoplasmic projections into the lumen of the capillary. Those projections break off and become the platelet fragments. Platelets age quickly and degenerate in about 10 days. Normal platelet count should be between 150,000 and 400,000 platelets per milliliter of blood. So here's our hematopoietic stem cell, which differentiates to a megakaryoblast, to a megakaryocyte. stage 2 and 3 to a megakaryocyte stage 4, and then blebs off into platelets. So here's a summary of those elements, and I encourage you to take a look at it. Figure 17.2, study it as you are studying. And that's where I will stop now.